that gets too boring for a patient, sometimes I'll have them do it at different angles. I'll have them do it a little bit, do a little more extension, maybe around 90, a little bit higher, so it's a little bit more dynamic for them, but it's still an isometric. But it works the elbow flexors in a different angles, varying degrees. You can do active assisted range of motion with your opposite hand. You can use a wand or a cane like we did last week. You can use your other hand to help assist, gain some motion. And then of course, if we want to generally work on range of motion, we can do some active contraction of the biceps to work on the flexion as well. As we progress to strengthen, we can start to use light weight. And again, the position of the forearm can bias or emphasize the muscle that we need to work for the person's functional use, their work, whatever is meaningful to them. If it's typing, I might work on the forearm pronated. If it's driving, maybe I'll work in a little more forearm neutral. If it's carrying heavy trays or children, I might work in a little more supination. Whatever the case may be, we customize it to their needs. But I can use a light weight to emphasize biceps, brachioradialis, or brachialis. And then I can use an exercise band also to do the same kind of thing, right against resistance. Again, keeping in mind that I can either increase or decrease the tension that exists in the band, or I can double it up if I want to make it harder. We can always modify the band. We can do PNF diagonals to incorporate some strengthening of the elbow flexors, as we talked about earlier today. And then for more advanced, it says reverse action elbow flexion. That would be one of two things. That would be like a pull-up. That's a reversal of muscle action. So instead of bringing something up, we're holding on to something and we're bringing our body up to the wrists. So there's a little bit of a reversal of muscle action. So you can do pull-ups with the palms facing you in supination. That emphasizes the biceps. Some of the pull-up machines where you have assisted or weight assistance allows you to hold in a more neutral position, and then some people do pull-ups with their forearms pronated, and that obviously will emphasize the brachialis more. So you can do reversal of muscle action, and the other thing you can do if you're at a gym, if you have some kind of a rack, like a Smith rack or a bench press rack, you can actually hold on, and you can pull your upper body towards the bar. So it's basically the same kind of thing, but your body's at a little bit more of an angle. So that's more of an advanced reverse action of the elbow flexors. And again, keep in mind, you're having someone pull their body weight upwards, so it can be very demanding. It's only for higher level clients. And then we talked about using the body blade. So the body blade is a dynamic stabilization exercise where we have someone do something, and the elbow is basically it's not quite isometric, it's a very short pulsing motion, but everything is required to be in a very tight position. It's a quick contract and relax motion, and it does involve working the elbow flexors, depending on how you perform it. If we want to work on gaining strength and extension, again, we can do isometrics. Sometimes I'll have a patient just put their forearm up against the wall and just press. You can have them sit in a chair, and they can press down to the table. Try to straighten your elbow down to the table. They can obviously resist with their opposite hand. Push down to your palm with your fist to work triceps isometrically. We can have them do active assisted range of motion. You can have them do it in a gravity eliminated plane. So you can have them, you might have the table a little bit higher. So you can do some active assisted. You can help with your opposite hand. You can work with the cane. Okay? So you can use your other hand to help push the other elbow into extension. Okay, so it's a little bit of active assisted. And then you can do active range of motion. Typically, you're going to be most effective if you put them in the test position. So I'll either have them lie prone and work as we did in the test position for the manual muscle test. If they can't tolerate prone, typically, I'm going to have them try to do it in this position. So they're keeping their humerus stabilized, and they're basically working against gravity in this position. So it's a little bit different, but this would be another way to do it for people who can't tolerate lying prone. And then the progression to be more intermediate would be doing the same thing, either in the test position or supine with a weight. Okay? So you can have them do the tricep press here. But I think most people prefer to do it here. Okay? So they can do it here. In supine, shoulders flexed about 90 degrees, and I'm basically controlling the extension against the weight of gravity. It's very important that they stabilize the humerus with pillows or using their contralateral hand. And then we can do PNF resist diagonals, emphasizing elbow extension if we want to work the triceps a little bit more. And then for the more advanced, the body blade works great. And then can anyone think of a good reversal muscle action to work on elbow extension?
Push-ups.
Okay, push-ups are good. What's another one that you see at the gym?
Dips.
Dips, you got it. So push-ups are great, and then dips are, the one where we lower our body weight and allow our elbows to go into an eccentric contraction, and then boom, they bring our body weight up, and our elbows do concentrically contract to move our body weight.
Hey Brian,
Okay, what?
could the seated dips be considered like a mid-range, like an intermediate? I guess it could, right?
It's pretty advanced, I think.